We will talk about premenstrual syndrome, its signs and symptoms, and treatment naturally. It affects almost any women. It affects more than 90% of women at some degree. Premenstrual syndrome usually occurs a week before menstruation and will resolve itself within the 4 days after bleeding begins. First and most common symptom of premenstrual syndrome is mood swings. It happens because of dropping estrogen levels. You can see it is period of ovulation, and after ovulation estrogen level will decrease, and when estrogen level is low, serotonin level also decrease in the brain, and it causes irritability, sadness, sometimes anger, short-tempered. Women may be tearful without clear reason. Is mood swing, and mood swing is very common. It affects almost 80% of women during premenstrual syndrome. So it's very common condition, and key player here is low serotonin level because of low estrogen level. Second most common symptom is fatigue and tiredness. It happens because of increased serotonin, increased progesterone level. Progesterone is another sex hormone which plays important role in menstrual cycle, and progesterone has effect of calming on the body, and it increases sedation, and person feels more tired, more fatigue. Also, it increases body's core temperature, and also it decreases quality of sleep because these hot flashes sometimes or night sweats, and person feels tired during the day. So fatigue and tiredness is second most common symptom of premenstrual syndrome. It affects almost 60% of women at some degree. Third most common sign and symptom is fullness and temporary weight gain. Why weight gain happens? It happens because of low estrogen level, causes water retention in the body, and it causes sensation of abdominal fullness. So water retaining is important here, and it causes weight gain around 1 pound. Usually 1 pound is around 0.5 kilograms, and sometimes weight gain can be very prominent, up to 6 pounds. It depends what person eats and how much water she intakes. If person eats food with lots of sodium, then weight gain is higher. Usually this weight gain will subside after several days after menstruation, but it lasts for several days. Also, low estrogen level slows down digestion, and it causes bloating and gas formation, and it causes discomfort, fullness, and weight gain for women. Fourth most important and most common sign is breast tenderness. Breast tenderness happens because of high progesterone level. High progesterone causes breast enlarge and water retention, including in the breast. Also, breast tissue development, breast becomes more sensitive, and breast becomes more tender and painful. And here prolactin also plays a role. Prolactin causes development of breast tissue and milk ducts. It's not enough to start milking, but it's enough to become breast enlarged and more painful and more sensitive. You can see the tendency of progesterone. This yellow is progesterone. Progesterone is low at first stage of menstrual cycle, and from second stage it increases and then decreases abruptly, and then menstruation starts here. So in luteal phase we have high progesterone, and this progesterone causes breast enlargement and breast tenderness. And fifth most common symptom is Cramps, abdominal cramps. It happens because of production of prostaglandins. It's part also luteal phase. Prostaglandins are synthesized and they cause contraction of uterine, and this uterine contractions is painful, and woman feels painful contractions, painful cramps. And headaches also common. Headache happens because of fluctuations in hormones, and it causes constriction of blood vessels. And food cravings also very important, when very common also. It happens because of low serotonin level, and low serotonin level causes food cravings, because person urges to eat food which increases tryptophan level and which eventually increase serotonin level. And it happens when person eats carbohydrates. It increases insulin increases transport of tryptophan into brain. Tryptophan is precursor of serotonin, and from tryptophan serotonin is synthesized, so person feels better. That's why we love sugar and sugary foods also, including chocolate also, and bakery products and other carbohydrates, because eventually they increase tryptophan level and serotonin level. Also they increase dopamine level in the body. Now let's say supplements, how to treat, how to manage premenstrual syndrome. Naturally, calcium supplements is considered one of the most effective. It decreases mood swings almost 48%. It's very high number. It means it's very effective. Also, calcium helps neurotransmitter synthesis, and safe level of calcium daily is considered up to 1000 milligram per day. So calcium is considered one of the most important and safest and effective supplement for premenstrual syndrome manage. Second most important is magnesium. Magnesium helps to prevent weight gain, also prevent fluid retention, improve mood stability, improve mood, and reduce anxiety and irritability. Its effectiveness is around 34% decrease symptoms, and safe and effective dosage of magnesium is 200 to 400 milligrams per day. Third most common and important supplement is vitamin B6. Vitamin B6 is important for neurotransmitter synthesis in the brain, and also it decreases irritability, and it decreases premenstrual symptoms by 25%. So it's also effective and important, and safe dosage is around 50 milligram to 100 milligrams per day. Chesterberry also is very important supplement. It's considered one of the most effective. It increases progesterone level. Also it acts like dopamine, so it improves mood, and it inhibits prolactin also, and it decreases breast tenderness. So it has very perfect combination for premenstrual syndromes. Of course, men should not intake chesterberry because it can affect person's erectile function and libido. So chesterberry is a perfect combination for women, especially during premenstrual period, but it's not perfect for men. It decreases premenstrual syndrome symptoms around 48%, and 20 to 40 milligram per day is considered safe and effective dosage. Evening primrose oil also common. It contains gamma-linolenic acid, and it is important for synthesize prostaglandins, especially anti-inflammatory prostaglandins. So we should remember that we have two types of prostaglandins: anti-inflammatory and pro-inflammatory prostaglandins. And gamma-linolenic acid promotes synthesis of anti-inflammatory prostaglandins, so it decreases inflammation, decreases cramps of uterine, so decreases symptoms of premenstrual syndrome. Safe dosage is 500 to 1000 milligram per day. And ginkgo biloba, also well-known supplement. It has anti-inflammatory action, antioxidant action, and improves blood circulation. So it's effective, but it's not as effective as, for example, vitamin B6 or chesterberry or magnesium or calcium supplements, but still effective. Daily dosage is around 80 to 240 milligrams per day, and you should be careful if you intake blood thinners because it can increase bleeding risk. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.